I have the great honor and pleasure to introduce my dear friend and sister, Professor Nermine Mostafa, Professor of Clinical Oncology from Ain Shams, Cairo University. She will give a short update about what we are doing in the Presidential Initiative for Cancer Management in general. And I guess that we are all eager to listen to what you are going to present. The floor is all yours, Professor Nermine.
Good afternoon, everyone. Thank you so much, Professor Ahmed, for this great and warming welcoming for me. And hopefully everyone have a very good lunch. Bon appetit for everyone. And I will take very, very quick overview about the Presidential Initiative of Cancer Early Detection and Management. First of all, I would love to introduce myself. I'm Nermine Mostafa, the head of Clinical Oncology Unit at Ain Shams University Specialized Hospitals and member of the Scientific Committee of the Presidential Initiative of Early Detection and Management. And a great honor to be among this prestigious the world leader in gynae oncology, and welcome. I'd love to welcome you in Egypt, and hopefully you'll enjoy this rich scientific agenda and to have time to enjoy Egypt, Cairo as well. The Presidential Initiative for Cancer Early Detection and Management, it tackles the 4 preventable cancers: colon, prostate, lung, and cervix. And it's a continuation of the great success of the Presidential Initiative of Women Health that was focusing on screening for breast and management of breast. And it's a great honor to have Dr. Ahmed is one of the Scientific and Executive Committee of the Presidential Initiative of Women Health. The initiative electronic system, both initiatives, the Initiative of Women Health and Early Detection and Management, are managed electronically through an electronic system from the initial registration and diagnosis stage to treatment stage, and data collected, including demographic data, medical history, and family history, to be used on national projects for research and publications later on. And we have the great honor to have, for the first time in the biggest international cancer conference, the European Society of Medical Oncology, the great achievement of publication about the national project of the women health that had been published in October in the ESMO conference by the great team of the Presidential Initiative of Women Health. Initiative electronic system for cancer early detection and management, the steps that the Egyptian citizen will go for the primary health care units and will be referred for the suspected tumors. More diagnostic process will be taken and then referred for any pathological testings and steps. And if the case is considered to be positive and diagnosed with cancer, will be managed in a multidisciplinary tumor board and then the management accordingly. The Egyptian approach for the women health and cancer early detection and management, it includes the main 8 pillars, which it started with the awareness for the community and healthcare professionals, early detection, diagnosis and management, and now we are targeting, even though the survivorship, data management and centers of excellence, and we are having now multiple centers, breast cancer centers of excellence, the NCI breast cancer that led by Dr. Ahmed, and Harmel Center, breast center excellence and training research. Aiming to, as we all know, that the hazards or the disadvantages for the cancer burden, that we are having more than 60% people were diagnosed with cancer and experienced the cancer on psychological and psychological effect, anxiety, depression. 2.1 maternal orphans per cancer deaths. Cancer affect women, 2.7 million women aged 25 to 54 years in the childbearing period, and more than 30% people affected by cancer and caregiver experience unemployment after diagnosis, and the financial toxicity that suffered from diagnosis of this disease, and more than 70% experience financial distress or hardship. And we will have gross domestic product loss from 0.5 to 2%. The regional and international positioning, we are having the positioning of Egypt as a successful model for cancer control in low middle income countries with large population, scientific recognition of our projects from all reputable international bodies, and collaborative scientific agreements with regional and international organizations. The objective of the initiative that having early detection of cancer in early stages to decrease the mortality rate and increase the cure rate, reducing the late stages and the burden of the late presentations of the disease, and eradication of cervical cancer in Egypt with the WHO mandate by 2030 to have cancer cervix elimination. And this is the WHO cancer initiatives covering the women cancers, the cervix and breast, the cervix cancer elimination initiative that by the strategy of 90% of the cases to have vaccinations for boys and girls, and 70% of the females to undergo screening and early detection, and 90% of the cervix cancer cases to be managed in a multidisciplinary treatment and receive the adequate treatment and standard of care. And on other women cancers, the breast cancers, we're having the Global Breast Cancer Initiative with annual decrease in breast cancer mortality 2.5 per year, with the launch of different frameworks in 2023 with plan of implementation of the 5 WHO milestones by 2023. Quickly, we are having the initiative had been launched in June this year, June 2023, as phase 1, implemented in 9 cities out of the 27 cities of Egypt. And the initial results up to 25 November. On the colon, we are having positive 17 cases colon cancers, and most of them were younger than 50 years old, and 183 cases benign tumors that had been treated, and that we are having the objectives of the initiative to treat the precancerous lesions and have prevention of colon cancers. And the lung cancers, we are having 3 positive cases and 4 with benign pathology. Prostate cancer, 35 positive prostate cancers and 6 benign pathology. Cervix, up till now, up to 25th of November, HPV positive cases, 38 females, and up till now there was no positive cervical cancers, and this was out of almost 2 million questionnaire, and more than 69% of the total number of 2 million questionnaires were females, and 31 were male. And this is one of the challenges that we are facing, that we are want to increase the awareness, the orientation of the initiatives to increase the engagement of the population for the cancer early detection. And then they were referred for the rest of diagnostic procedures for the lung cases, referred for the low-dose CT, 24,873 cases, and for the CT with contrast, about 37. For bronchoscopy, 4 cases. For PET-CT, 38 cases. For CT biopsies, 12 patients. And for lung pathological sample collected, 7 patients. And then finally was having 3 positive cases. For the colon cancers, referred for the FIT test, and this is the first time to have the FIT test in Egypt for free, including in this national project. 121,000 cases, and cases that referred for the colonoscopy were 877, and sample taken were 200. Precancerous lesions were 25, and positive colon cancer cases were 17, and the benign pathologies were about 183. For the prostate cancers, for the number of men who were referred for PSA, 87,000, and for the multiparametric MRI, 176. For trust biopsies, 132 men, and pathological cases, 40, prostate pathological analysis, 41 men, and positively confirmed 35, and 6 were benign. For the cervix cancer, referred for the cervical smear, 7,000, almost 7,216 female, and that out of them who were referred for colposcopy were 82 females and 38 female diagnosed HPV positive. And I know that there are some defects in the number and the statistics, and that was one also of the main challenges for the initiative, to work on our infrastructure, invest in the human resources and the equipment. And this is the graph showing the referred for the tumor detections out of the more than 200 million questionnaires, and distributed among the 4 cancerous: lung, colon, prostate, and cervix. This is the red one for the females. Out of the 2 million, the majority were females, and out of the 1.5 million females, 7,000 females were tested for the cervix cancer, and on the blue slide, the 685,000 men, and that referred for the prostate cancer detection, almost 87,000 men, 12%. Citizens from 18-year-old can fill out the questionnaire. Anyone 18 and older is eligible to have the questionnaire, which is composed of 70 questions that can be filled in like less than 10 minutes through 3,663 primary care units nationwide, distributed all over Egypt by your national ID and we have also electronic access through the social media platforms for the Ministry of Health. And then according to the results of the questionnaire, if we can go for further steps and more steps are required, or just the citizen will go for the follow-up pathway. And this is, as we are concerned now about the cervix, this is the pathway of the females for cervix cancer. Females who are at high risk for HPV infection will go for the pap smear. If positive, she will go for the further step colposcopy. If abnormal cells, biopsy will be taken for pathological testing, and according to the results, if cancerous, will be presented and managed in multidisciplinary tumor board, and if precancerous lesions will be treated and referred to the gyne-oncology treatment planning units. And this is the results of the pap smears for the females who were referred for the pap smears. Almost 7,000 females were referred for the pap smear. Only 947 did the pap smear, and out of the 900, almost 947, 38 were positive, and the rest were negative. Actions taken to develop the services provided: providing pap smear to the hospitals, training physicians and nurses, the healthcare professionals on the pap smear and colposcopy procedures, including examination and biopsy, providing portable colposcopy for hospitals, and especially the area or hospitals that were lacking of these devices. As all we know that cervical cancer is the 4th most common cancer in women worldwide and the 7th most common cancer overall, and globally in 2022 there were estimated 604,127 cervical cancer cases, and unfortunately most of them were presented in the low middle income countries with late presentations. The risk factor for cervical cancer, as we all know that the most common or the main cause of cervical cancer is HPV. Some HPV type can cause changes on the woman's cervix that can lead to cervical cancer over time. Other risk factors, acquired immune deficiency, tobacco smoking, multiple sexual partners, and early marriage. Eradication of cervical cancer through screening and HPV vaccination. In 2006, the first vaccine for HPV is approved. HPV vaccination goes to become the key part of the effort to eliminate cervical cancer. And HPV type 16 and 18 are responsible for 70% of the cervical cancer worldwide. And HPV vaccines that prevent against HPV 16 and 18 infection are now available and have the potential to reduce the incidence of cervical cancer. And it's recommended to do vaccination at age of 11 or 12 years old, and it works best when given before exposure to HPV. And it's the main primary preventive method for preventing cervix cancer. Among teen girls, infections with HPV type that cause most HPV cancers and genital warts have dropped to 88%. Among young adult women, infection with HPV type that cause most HPV cancers and genital warts have dropped to 81%. And among vaccinated women, the percentage of cervical precancers caused by the HPV type most often linked to cervical cancer have dropped by 40%. The future and the next steps and the way going forward for cancer care, health system sustainability in the Middle East and the North Africa. The key trends with over 100 million people, and Egypt has one of the largest, it's the 3rd ranking in Africa continent as the largest population. We are almost above 120 million. The over 65 population make up just over 5% of the total population today, is expected to double by 2040, and by 2040 we are expecting that we are having the increases of the cancer cases. Egypt has higher incidence of liver, bladder cancer than the global average, which is attributed to the high prevalence of HCV. And as we all know that we have celebrated that that Egypt has eradicated hepatitis C for liver cancers, and a higher but decreasing prevalence of bilharziasis and growing prevalence of smoking and other risk factors for bladder cancers. And this is the two graphs that showing the incidence projections, estimates 2020 and 2040 for the population and different cancers going the highest. The liver was increased more than almost 8%, and breast cases and bladder. And the other graph showing the cancer's mortality projections from 2020 to 2040 among different sexes. On the policy level, that Egypt has integrated the non-communicable plan, up-to-date National Cancer Control Plan and National Cancer Diagnosis and Treatment Guidelines. While the early detection and screening program are less developed, recent efforts, policy, direction and resources, including the 100 million Healthy Lives initiatives, have helped improving screening and early detection services for hepatitis C, and was decreasing the cases of HCC, lung and prostate. The Egyptian Women Health Initiative was launched in 2019 with aim of screening at around almost, and I think it's increasing, more than 30 million women for breast cancer. As of March 2023, was over 34 million women have been screened. Over the healthcare system, reforming is critical to Egyptian vision for 2050. The country national development agenda and the non-communicable disease prevention has been a priority for Egyptian government over recent years, with the 100 million Healthy Life program to provide routine testing and treatment for infectious and chronic diseases, including hepatitis C and obesity. And as part of the Women Health Initiative, not only screening for breast screening, but it's screening for the non-communicable diseases, the body weight, to screen for obesity, the blood pressure, to screen for hypertension, and the complete blood picture to screen for anemia cases. Innovation and data, Egypt leads the MENA region in terms of research output with higher number of academic publications and clinical trials. In 2020, the Egyptian president issued the Regulating Clinical Medical Research Bill to establish a framework for managing clinical trial, improving Egyptian National Cancer Registry Program, which is a key focus for the National Cancer Control Program, while adopting digital health and the era of the artificial intelligence that could help reducing unmet healthcare needs and improving access for remote area in the country, will lead to address disparity in internet access. And this is the showing 72% of individuals using the internet, according to مركز الحسابات والمعلومات، ان اكثر من 80% من الناس عندها سمارت فونز و they are having access to internet. 0.6% research and development expansion, 90% number of mobile subscriptions per 100 people on 2021, and the total number for clinical oncology in 2022 was more than 1,000, and it's increasing. Health financing, healthcare spending is expected to rise in Egypt as the country moving toward achieving the universal health coverage as part of transforming Egypt's healthcare system project. Current devaluation is also increasing the financial stresses on Egyptian patients who are out-of-pocket spending is high, and implementing the health telemedicine is crucial for attaining the universal health insurance objectives, expanding access and enabling better resources allocation and evidence-based decision-making, introduction of fast-track approval mechanisms, the EDA reform and incentives for locally manufactured products, and helping to accelerate access to new medicines. The future for cancer care in the Middle East and North Africa, the conclusions for the health system in the region, expanding screening programs, and elevate immediate financial pressure collaboration in the transition to the universal health care coverage. And thank you.
Thank you, Dr. Nermine. I guess that what I have been discussing as well on the side talk, and I'm sorry for this, but we were discussing, and Dr. Atalla is really astonished by the effort done. However, just to highlight two parts, that the cervical, it's not a screening program, it's an early detection program. So this is not a mass screening. And I guess if you, in a 30 seconds, highlight how the questionnaire will lead to identify the high-risk HPV patient, because this is something that was missing in your explanation. So if you can tell us how the questionnaire for the women at risk, that will result that you have the 7,000 females that were having the HPV testing.
Yes. One of the main challenges, but we are trying to put the questions in the questionnaire, and we are still editing and reviewing the questions. One of the challenges were the smoking index, how to calculate the smoking index in our country, as we are having the smokers at a very, very young age, in the teenagers that then smoke in the high school, and we are having different smoking methods, not only the classical smoking or cigarette smoking, we are having different smokings. So it was one of the challenges when we are putting the risk factors as for smoking and for the multiple sexual partners, and to be accepted or digested culturally. We try to put it as different, that if her husband, if there's different marriage or not. And we try to put family history as a risk factor. I know it's not the standard risk factor for cervical screening, but we try to make it as a common environmental factors among the family that they can share and having the same risk factor for cervical. So it was very, very, very challenging to put the risk factors for different cancers. The top were lung and cervix. We try to modify them, and I think we still need to edit and revise and modify them step by step.
This have to be worked upon.
Yeah.
Thanks, Nermine, so much for your presentation.